out of the box thing we're doing. Wizard of Oz? No? Hello, my name's Scott. I'm a physical therapist assistant here at Northmore Orthopedics. Today we're going to talk to you about some ankle pain. So today I'm going to talk to you about Achilles tendonitis. This is our physical therapist tech here, Carolina. She's going to be helping us with some of the exercises. Now, Achilles tendonitis is inflammation of the tendon, usually due to overuse. And our Achilles is right in the back of our ankles, right at the bottom right here. And it comes all the way up and it connects to our gastrocnemius and our soleus as what we call our calf. So to treat tendonitis, like I said, it's overuse. So what we need to do is we first need to stretch it out and kind of break up some of the adhesions going on in that tendon itself. So the first stretch we could do, this is a strap that we use in physical therapy. You could use a belt, a dog leash, a bed sheet even. And what I'm going to ask Carolina to do is she's going to scoot back, have her legs straight on that table while she's sitting up or laying down. If you're more comfortable doing laying down, you can as well. We're going to say it's her right ankle. I'm going to take this strap right along the ball of her foot right in here. And what she's going to do is she's just going to gently pull until she feels a nice stretch in the calf. Do you feel that? Perfect. So she could do this 10-second holds 10 times. And if 10 seconds doesn't feel like a long enough stretch for you, you can do 3 30-second holds as well. So another good way to stretch our calves when standing is I'm going to ask her to face a wall, and she's going to stagger her feet right now. So say we want to stretch the right leg, I'm going to have her right leg behind her. And what she's going to be doing is she's going to have her hands on the wall, and she's going to be lunging into that wall, acting like she's trying to shove the wall away while trying to keep this back heel down on the ground. Now, every time she gives force into that wall trying to shove, she should get a nice stretch up in here. Are you feeling the stretch? Perfect. So this one, she could do 10-second holds 10 times as well. So another good way we could stretch the calf, and it's a little bit more aggressive than the other two that I showed you, is I'm going to have her at a step right here. She's going to step up on that first step, and she's going to have her heels just a little bit off that stair so that the ball of her feet is on the edge of the stair. Now what she's going to do is she's going to slowly lower her body and let gravity kind of take its hold and pull her down. Keeping her toes up there, everything is nice and relaxed, and she should be getting a really nice stretch right now up in her calf. You feeling it?
Yep.
Good. So again, she could do 10-second holds. If you feel like 10 is enough, you could do 3 30-second holds. So the next stretch we're going to have Carolina do, it's for the soleus. That's another muscle that's part of your calf. Now what she's going to be doing is the leg that she wants to stretch, she's going to be putting it on the second step right here. There you go. Now what I'm going to ask her to do is she's going to lean forward and lunge her body over. So that knee is going to pass over the toe. And at the same time, while she's doing this, she's going to try and keep this heel down on the step right here. She should be getting a nice, decent stretch right here, a little bit more towards the tendon, and maybe even a little deep in there. She's going to be doing this 10-second holds again. You feeling a little stretch? Perfect. So the next couple exercises we're going to have Carolina do are range of motion exercises for her ankle. Now, I have her sitting on the table right here. This is ideal because we have a little bit of room to move that ankle over here. And she's comfortable sitting like this. However, if she wasn't, I would just kind of have her leg just kind of out to the side, just like that. So we'll stay like this. Now, a really easy one she's going to be doing, it's ankle circles. All she does is she wants to do circles with that ankle. She's going to do 20 clockwise and 20 counterclockwise. Now, if you notice when she's doing this, her whole leg is kind of rotating out a little bit. So what she could do is kind of have one of her hands right up here by her knee and stop her whole leg from rotating. What's happening is she's using her hip to do a lot of that instead of just her ankle. Holding the leg, making sure it's not rotating along with the ankle, really isolates the ankle itself. So again, she's going to be doing 20 each way. So the next exercise we're going to have Carolina do is another range of motion exercise. We call it the ankle alphabet, A to Z. So it's very easy. All she's going to be doing is spelling out the alphabet with her foot, right? So again, as she's doing this, go slow so that they can see. Start again at A. So she's going to be doing A, and then the cross, and then B. She's going very slow, and she's making sure that she's not rotating this whole hip again. Again, we want to isolate the ankle. This is good to keep the mobility in the ankle as well, and prepare us for strengthening exercises. So now that we worked on a little bit of stretching and range of motion for Carolina's ankle for Achilles tendonitis, we're going to start working on the strength of the ankle a little bit. Now, we want to keep in mind that Achilles tendonitis, like I said, is inflammation of that tendon from overuse. So Our Achilles, our gastroc, our calf, is responsible for pointing our toes like this. That causes everything back here to tighten, and it will increase the inflammation if you do it frequently. Now, when we're strengthening the ankle with tendonitis, what we want to do is we want to avoid that motion specifically, because all we're going to do is flare it up even more. So what we could start with, this is a TheraBand. You could get these at Walmart, Dick's Sporting Goods, Amazon especially. Different companies go off different colors. Usually it goes yellow is the easiest, and then comes red, then comes green, and then comes blue. So we're starting with yellow just because she's just starting. And we're going to be putting this right across the top of her foot. Now, I'm holding it tight right now. What she's going to be doing is she's going to be pointing that toe up to her face. And she could start with these 10 times. And then when they get pretty good, pretty easy, she could go up to 20 times. She's going to be feeling this all up here in the shin. So again, we're avoiding pointing the toe with resistance, and we're going the opposite direction, actually. That's good. And then the next one from here, I would just go to the side. Now, since I'm here to assist her, I can actually hold her leg here to make sure that she's not rotating that hip at all and trying to assist the exercise. She's going to point her toes in now. Good. So watch that rotation. Looks good. She's going to feel this on the inside of her ankle now. You okay? Good. And then from here, we just flip to the other side. Same thing. That's the whole exercise. Like I said, 10 reps, and then when they get easy, she could up them to 20. And again, we are avoiding this direction for now. When she gets good at it and everything's starting to feel a little better, we can slowly start to incorporating strengthening of her Achilles and her gastroc again. But for now, we want to avoid it. So in most cases, you may not have someone to help you with the TheraBand and holding your leg. So in that case, I'm going to show you how to use a pole or like a table leg or something like that to kind of assist you in the exercises right there. So first, I take the TheraBand. I would kind of tie it around here, make sure it's nice and tight so that it doesn't snap you. Just like so. And then what I could do is I get my foot in here, just like this. Now, again, I have myself to kind of hold my knee and stop myself from rotating. And I could bring my ankle in now. Now I'm working the inside of my ankle. From here, let's see if I can untie this thing. There we go. From here, I can tie it into a circle again. We'll say I tied it because I don't want to go through the hassle of tying it. I could be just like this, stepping on this side. And then now, I could do these going outside. Good. And watch my knee, my hip are not rotating. It's only my ankle. And then from here, there's a couple different ways to do this. This tends to be the most effective if you're okay getting your leg up here. You kind of hold it right here and you just hold your knee and just flex up, just like so. All right. And then if you're still having trouble with that, it's a little more difficult, but if you could figure out a way to weigh this side down over here, I could go up now, just like this. Again, we're avoiding going down. So another good exercise that we could do for Achilles tendonitis, although we're targeting the hamstrings on this one, is a hamstring stretch. This is good because what we're going to do is we're going to be targeting the entire back side of the leg rather than just the calf. So what we want to do is that this is a belt, strap, whatever you have at home. She's going to be putting that around her foot, keeping that leg, whole leg nice and relaxed, and pulling up until she feels a nice stretch right in the back of her knee. Reason this is good is because not only are we getting a hamstring stretch, we're actually getting a little bit of a calf stretch because that calf actually spans up into the knee a little bit, actually assists in a little bit of knee flexion. So she's going to be holding this 10-second holds 10 times. And if that's not enough hold for her, she could do a 3 30-second hold. All right, so another good exercise that we could do for Achilles tendonitis is just a long arc quad. Now that involves sitting right here. And what this is going to do is it's going to allow us to maintain our strength in our quadricep and actually activate the dorsiflexors in the front of our ankle a little bit, which allows us to deactivate the calf. All right, so what she's going to be doing is she's going to be pointing her toe up, and she's just going to be straightening out that knee just like so. When she does this, she may even get a little bit of a stretch in the back of the leg. That's okay. And she's going to be doing 10 times 5-second holds. So what I'm doing right here actually is I'm rolling out my gastroc, my calf right now with the foam roll that we have right here. What this is doing, I'm applying a little bit of pressure as I'm rolling, and what it's doing is breaking up a little bit of soft tissue restrictions, some adhesions that we have in our calf. This will allow it'll allow the calf to loosen up a little bit more, which in turn helps the tendon. And you want to do this for about 3 minutes, 5 minutes, no more than 5 minutes. And then afterwards, ice is very good for inflammation of tendons, for tendonitis. What the ice does is going to help decrease inflammation, decrease pain levels, and it'll allow for more mobility because you have less swelling. So remember, because we have inflammation of our tendon due to overuse, we want to avoid strengthening it off the bat right away. So slowly progress into strengthening of your calf. If you do too much too fast, it's going to cause a lot of pain, and it will not get better. So that leads me to my next point. If you feel like it's not getting better, I want you to come over and see us at North Point Orthopedics, and we hope you have a great day. Thank you. Bye.